Everything you need to know about phobias. A phobia is a type of anxiety disorder in which a person has an extreme, irrational fear of a situation, living creature, place, or object. When a person has a phobia, they frequently shape their lives to avoid what they perceive to be dangerous. The imagined threat outweighs any actual threat posed by the source of terror. Phobias are treatable mental illnesses. When confronted with the source of their phobia, the individual will experience intense distress. This can impair their ability to function normally and, in some cases, cause panic attacks. What is a phobia? The term phobia is often used to refer to a fear of one particular trigger. However, there are three types of phobia recognized by the American Psychiatric Association, APA. These include specific phobia. This is an intense, irrational fear of a specific trigger. Social phobia, also known as social anxiety, is a severe fear of public humiliation and being singled out or judged by others in a social setting. For someone who suffers from social anxiety, large social gatherings are terrifying. It is not synonymous with shyness. Agoraphobia is a fear of situations from which a person would be unable to escape if they experienced extreme panic, such as being in a lift or being outside of the home. It is frequently misinterpreted as a fear of open spaces, but it can also refer to being confined in a small space, such as an elevator, or riding public transportation. People who suffer from agoraphobia are more likely to develop panic disorder. Because their triggers are less obvious, social anxiety and agoraphobia are classified as complex phobias. Complex phobias can also make it more difficult to avoid triggers such as leaving the house or being in a large crowd. Symptoms: a person with a phobia will experience the following symptoms. They are common across the majority of phobias: a sensation of uncontrollable anxiety when exposed to the source of fear, a feeling that the source of that fear must be avoided at all costs, not being able to function properly when exposed to the trigger, acknowledgement that the fear is irrational, unreasonable, and exaggerated, combined with an inability to control the feelings. A person is likely to experience feelings of panic and intense anxiety when exposed to the object of their phobia. The physical effects of these sensations can include sweating, abnormal breathing, accelerated heartbeat, trembling, hot flushes or chills, a choking sensation, chest pains or tightness, butterflies in the stomach, pins and needles, dry mouth, confusion and disorientation, nausea, dizziness, headache. Anxiety can be induced simply by thinking about the source of the phobia. Parents of younger children may notice that they cry, become clingy, or try to hide behind the legs of a parent or an object. To express their distress, they may throw tantrums. The most common specific phobias: claustrophobia, fear of being in constricted, confined spaces; aerophobia, fear of flying; arachnophobia, fear of spiders; driving phobia, fear of driving a car; emetophobia, fear of vomiting; erythrophobia, fear of blushing; hypochondria, fear of becoming ill; zoophobia, fear of animals; aquaphobia, fear of water; acrophobia, fear of heights; blood, injury, and injection, BII, phobia, fear of injuries involving blood. These are by no means the only specific phobias. People can become afraid of almost anything. Also, as society evolves, so does the list of potential phobias. Nomophobia, for example, is the fear of being without a cell phone or computer,